My name is Tony Heffernan. John's given the introduction. I'm also the father of 2 children who had Batten disease. Unfortunately, I lost my little girl last year, age 5, and I have a 4-year-old son, or almost 4, Liam, who's dying from the same condition. So this is very much close to heart. I had a lot of help in preparing the subgroup submission, which we gave to Department of Health at the steering group in the 28th of February. And I want to acknowledge all the help and assistance I've had doing that. This is not a lone task. We have to represent all patients from all different backgrounds. We have a very simple vision. It's timely diagnosis with automatic access for all those affected by rare conditions. That goes from whether you're an adult child or whether you're the parent, to ensure that you get this for your loved one. There's a lot of stress involved with this, and we always push forward the fact of making everything we do patient-proof and ensuring that the other subgroups make it patient-proof as well. This is not just something we're going to sign off on. The subgroup submission process, which is leading to the workshops today, we've done a very detailed background and investigation on the whole process. I've tried to lay it out here as quickly as I could. We invited everyone to participate via the umbrella groups, GERDO, IPOSAI and the MRCG, and also groups which are not part of those organisations. We reached out to them wherever we could and used social media and every access we could to get as much participation as we can, and this will continue. There was 2 surveys done. One was a patient experience survey, which Avril touched on, and also the patient organisation survey, to get a feedback on what the actual experience factor is when living with a rare disease in Ireland. We've done a personal review of services and personal experiences. That's, again, more or less interviewing people and getting their feedback of what it's like to have a child or be a person with a rare disease in Ireland, and see where we're going wrong, and more importantly, see what we can do to make it better. There's no point reflecting on what's not working. It's better to look forward and see what's going to work, and then shout for it as loud as we can. We examination of the legal requirements, both national and EU. This will not happen without effective legislation to guarantee the rights of persons with rare disease, to ensure that they get the best access to care and whatever they need to make life a better place, especially for those with life-limiting disorders. We also done a review, more importantly, of the existing rare disease plans and initiatives across Europe and beyond. We have no point in reinventing the wheel. Evelyn also made a comment that there are plans out there in France and in other countries throughout Europe which have made positive impacts. We don't have to reinvent them, we just have to adapt them to the Irish system. So this is a first step. It is a stepping stone. We're going across something new, and it's an opportunity to improve the lives of those affected. The Minister made a very strong point that we want to make positive impacts. However, to make positive impacts, we have to push forward with what we say we're going to do and then do what we say. We can't just leave this go off once and not make the most of it. This has to work. But there will be an Irish rare disease plan too, I'm sure of it, and this will be a continuing, ongoing improvement process. So patient support and empowerment. It needs effective psychological and social support services. We do have to recognise the valuable work done by patient organisations and umbrella groups. Specialised support services for those affected by rare disease, because rare disease is not just about health and clinical. It also transcends into educational and other social needs, which have to be all linked together through the various state departments. State benefit schemes and services, again, this is back down to social services and social support, financial support, and again, legislation. So this is what we think feeds into the national plan. And we see it all as equal in value. It all has to go. But implementation is the biggest thing I would like to focus on. All of this comes automatically, whether it takes 10 years or 5 years or 5 months to get diagnosed. The common elements are the same, and they all have to be part of the national plan. But it's how we implement it that make the difference to the people affected. So I will always try and voice my own opinions and those of the subgroup as strongly as possible to patient-proof it. I have to say patient-proof over and over again. This has to work for those who are affected. And we need a management of change process to get from where we are now to where we want to be. So the Minister's already indicated he wants to make an impact on the lives of those, and how we do that is manage the process. So a successful plan requires good implementation. We need clear, defined policies and protocols. We have to set out who's responsible. The effective need new and changes to existing legislation. We have some very good legislation and just needs to be adapted. Example, the Disability Act. That can be adapted to change to make a difference for rare diseases as well. We just have to ensure that it's all updated and modernised. One of the biggest things is that we need a national office for rare disease as well, and we need a supervisory board to ensure that the National Rare Disease Plan and the 5-year strategy is implemented correctly. These are things that we don't have now, but I think they will become a very strong recommendation of the plan when it does come to the front. We have to ensure that it's suitably resourced, and that's the allocation of instruments, legal instruments and also financial instruments, to ensure that we can actually fund what we do. We have to be basic in our approach initially, but we have to cover those basics. There's my 5 minutes. My thing is vibrating up here. But thank you. No, I would just say we value your, please do not think that this is over. This is a process. It's still another step, and we need you to spread the word however you can to get as many people to participate in the online survey. Everyone's opinion counts. Thanks.